Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Vocational Education and Training, SOVET, Postgraduate Diploma in Pharmaceutical Sales Management, PGDPSM, MVE 002 Pharmacology and Toxicology, Unit-4 Drugs Action on Cardiovascular System. 4.1 Introduction. The heart is a mechanical organ that pumps blood to different parts of the body. The heart, along with the arteries, veins and capillaries, forms the cardiovascular system. There are various diseases that are associated with the malfunction of these individual components. Thickening of the coronary arteries leads to development of atherosclerosis and myocardial ischemia. Decrease in the pumping capacity of the heart leads to the development of heart failure. Conduction defects in the heart leads to the development of arrhythmias, and sustained contraction of the arterial smooth muscle leads to development of hypertension. Objectives. After studying this unit, you should be able to know about cardiac glycosides and their therapeutic uses. About the various drugs used in arrhythmia and their therapeutic uses. About the drugs used in angina pectoris and their therapeutic uses, and know the drugs used in hypertension and their therapeutic uses. 4.2 Cardiac glycosides and antiarrhythmic agents. 4th February 2001 Cardiac glycosides. Introduction. Cardiac glycosides are the drugs having cardiac inotropic property. They increase myocardial contractility and cardiac output in a hypodynamic heart. Without increase in oxygen consumption and overall myocardial efficiency is increased. The cardiac glycosides are mainly obtained from plants, e.g., digitalis, Strophanthes and squill species, and also present in certain other plants and animals. In 1776, William Withering, a Birmingham physician and botanist, identified digitalis and other ingredients, which was found useful in the treatment of dropsy. In 1911, Mackenzie and Kushner studied the effect of digitalis on heart and its use in congestive heart failure. Actions on body systems. Effect on heart contractility. Digitalis increases the force of myocardial contraction without causing corresponding increase in the oxygen consumption. This action forms the basis of its use in treatment of congestive heart failure. Cardiac output. Digitalis increases the cardiac output in CHF patients by increasing the force of myocardial contraction. Heart rate. Digitalis produces a decrease in heart rate. Automaticity. It is the ability to generate propagated impulse. Digitalis increases the ability of the Purkinje cell and the ventricular muscle to initiate impulses. Extracardiac actions. Apart from the actions on the heart, cardiac glycosides also exert actions on various other body systems. Digitalis produces diuresis in CHF patients. It increases excretion of sodium and water by the kidney, thus shifting edema fluid into the circulation. Digitalis can produce nausea and vomiting, which is probably due to the chemoreceptor trigger zone, CTZ, stimulation. Therapeutic uses. Digitalis is primarily used in the treatment of congestive heart failure. Digitalis increases stroke volume and cardiac output. Digitalis, by increasing the cardiac output, brings about more complete emptying of the ventricles during systole. This reduces the pulmonary congestion and edema and decreases the systemic venous pressure. The cardiac glycosides primarily correct systolic dysfunction. Other uses of digitalis are atrial fibrillation, atrial flutter, etc. Other positive inotropic drugs used in CHF. Bipyridine compounds. These drugs increase the force of contraction of the heart and also decrease the systemic vascular resistance by relaxing the arteries. The compounds used clinically are amrinone and milrinone. 4th February 2002 antiarrhythmic agents. The peculiarity of the heart tissue is that it can generate its own impulse. Under normal conditions, the normal pacemaker of the heart is the SA node. The impulse generated here is transmitted throughout the heart by a fine network of conducting fibers called the Purkinje fibers. During conditions like myocardial ischemia, mechanical injury to the heart, etc., the myocardial fibers start generating their own impulse and arrhythmias set in. Cardiac arrhythmias is a group of disorder characterized by an abnormal cardiac rhythm and arise as a result of disorders of impulse formation or conduction or both. Cardiac arrhythmias. The different types of cardiac arrhythmias can be classified into two broad groups, depending on the rate of the heartbeat. Tachyarrhythmias manifest as fast heart rate, more than 100 per minute, and bradyarrhythmias manifest as slow heart rate, less than 50 to 60 beats per minute. Important antiarrhythmic drugs. Quinidine. It is an alkaloid obtained from the bark of cinchona and is an isomer of antimalarial drug, quinine. Its sodium channel blocking property results in depression in the excitability of cardiac tissues, decreases pacemaker activity, and a decrease in the force of contraction of the heart. It is indicated in prevention of atrial and ventricular tachycardias. Amiodarone. It is a long-acting antiarrhythmic drug. It blocks inactivated sodium channels. It is indicated in tachyarrhythmias not responding to other agents. Britillaum. It has direct action on myocardium and interferes with the neuronal release of catecholamines and has direct antiarrhythmic property. It is used in the treatment of ventricular tachycardia and ventricular fibrillation. 4.3 Antianginal agents. 4th March 2001 Introduction. Angina pectoris is a symptom of ischemic heart disease. It develops as a result of an imbalance between the oxygen supply and oxygen demand of the myocardium. Decrease in myocardial perfusion is due to deposition of atherosclerotic plaques in blood vessels. These plaques are due to accumulation of cholesterol and other lipid compounds which develop as patches on inner side of blood vessels. 4th March 2002 Nitrates. Glyceryl trinitrate, GTN, is the prototype member of this drug group. It releases nitrite ion, number 2, which is further metabolized to NO by enzymatic step in vascular smooth muscles. NO released by GTN leads to relaxation of the blood vessels. Both large arteries and veins are dilated by GTN, but the action on veins is more prominent. GTN is used as a sublingual tablet in the emergency management of angina pectoris. It is used intravenously in the management of unstable angina, coronary vasospasm, left ventricular failure, accompanying MI, hypertension and during cardiac surgery. It is used in the form of ointment transdermal patch for the prevention of angina pectoris. Isosorbide mononitrate has the longest duration of action and is generally preferred for the prophylaxis of angina in susceptible individuals. 4th March 2003 Other antianginal drugs. Dipyridamole. It is a coronary dilator and claimed to dilate coronary resistance vessels. It probably acts by inhibiting the uptake and degradation of adenosine, a local mediator involved in auto-regulation of coronary flow in response to ischemia. It also has platelet inhibitory properties. It has been employed for prophylaxis of coronary and cerebral thrombosis in post-MI and post-stroke patients, as well as to prevent thrombosis in patients with prosthetic heart valves. 4.4 Antihypertensives and vasodilators. 4th April 2001 Introduction. Hypertension is the most common cardiovascular disease, and pathophysiologically hypertension can be classified into two main groups. A. Essential or primary hypertension, where the cause for rise in blood pressure is not known, responsible for majority of cases. B. Secondary hypertension, where rise is due to renal disease, e.g. chronic diffuse glomerulonephritis, pyelonephritis, due to some vascular disease, e.g. renal artery disease, or due to some endocrinal disorders, e.g. pheochromocytoma, Cushing's syndrome, and primary aldosteronism. Systemic arterial blood pressure is determined by cardiac output and total peripheral resistance. In most of the cases, rise in BP is due to increase in total peripheral resistance. Clinically, hypertension can be divided into three stages, e.g. mild, moderate, and severe hypertension. The diastolic blood pressure between 90 to 104 mmHg is graded as mild, 105 to 114 mmHg is graded as moderate, and above 115 mmHg is graded as severe hypertension. The blood pressure is mainly controlled by two systems. Firstly, through the baroreceptors and the adrenergic nervous system. The baroreceptor reflexes protect the circulation against stresses, which shows the changes in the arterial blood pressure. Secondly, through renin-angiotensin system, this is involved in the pathogenesis of some forms of secondary hypertension. Renin is a proteolytic enzyme released from the juxtaglomerular cells of kidneys. The reaction between renin and plasma protein, serum globulin, angiotensinogen, forms an inactive compound, angiotensin I, decapeptide, which further changed into angiotensin II, octapeptide, by the action of angiotensin converting enzyme, ACE, and is the most powerful vasoconstrictor agent. 4th April 2002 Important antihypertensive drugs. Clonidine methyldopa. These agents stimulate alpha receptors in vasomotor center of brain and decrease the sympathetic outflow, which results in fall of blood pressure and bradycardia. They are indicated in hypertension of all grades except pheochromocytoma, glaucoma, and migraine. Rizepine. It is an alkaloid known to deplete the catecholamines adrenaline, noradrenaline, and dopamine from the various sites in the body. As a result, the sympathetic tone in the body decreases. Prazosin terazosin. The detailed pharmacology of alpha blockers is already discussed in chapter Adrenergic blocking agents. Decrease in blood pressure is brought about by blockade of alpha receptors that leads to relaxation of smooth muscles of the blood vessels. Propranolol metoprolol. The detailed pharmacology of alpha blockers is already discussed in chapter Adrenergic blocking agents. Decrease in blood pressure is brought about by reducing heart rate and force of contraction. Captopril, enalapril. These drugs act primarily by suppressing renin-angiotensin-aldosterone system. The main action of all ACE inhibitors is to inhibit conversion of angiotensin I, inactive, to angiotensin II, active. They inhibit the angiotensin converting enzyme, ACE. Hence, angiotensin II production is inhibited. Decrease in angiotensin II results in dilatation of peripheral vessels leading to a reduction in systemic vascular resistance and a decreased aldosterone secretion. Losartan irbesartan, angiotensin II is a potent vasoconstrictor, stimulant of aldosterone secretion and an important component in the pathophysiology of hypertension. Losartan blocks the binding of angiotensin with its receptor. Verapamil diltiazem nifedipine, calcium channel blockers interfere with the calcium entry into the myocardial cells, leads to decrease in force of contraction of the heart and vascular smooth muscles, blood vessel relaxation. As a result, the blood pressure decreases. Hydralazine sodium nitroprusside, these agents release NO, nitric oxide, in the body and have action similar to that of glyceryl trinitrate. The released NO leads to vascular smooth muscle relaxation and decrease in blood pressure. The onset of action of these agents is very fast and duration of action is very less. Therefore, these agents are used by the intravenous route in the management of hypertensive emergencies, known as hypertensive crisis. 4.5 Summary. Times cardiac glycosides are the drugs having cardiac inotropic property. They increase myocardial contractility and cardiac output in a hypodynamic heart without increase in oxygen consumption, and overall myocardial efficiency is increased. Times digitalis increases the cardiac output in CHF patients by increasing the force of myocardial contraction. Times primary indications for digitalis include CHF, atrial and ventricular failure. Times cardiac arrhythmias is a group of disorder characterized by an abnormal cardiac rhythm and arise as a result of disorders of impulse formation or conduction or both. Times angina pectoris is a symptom of ischemic heart disease. It develops as a result of an imbalance between the oxygen supply and oxygen demand of the myocardium. Times hypertension can be classified into two main groups. A. Essential or primary hypertension, where the cause for rise in blood pressure is not known, responsible for majority of cases. B. Secondary hypertension, where rise is due to renal disease, due to some vascular disease or due to some endocrinal disorders. Times ACE inhibitors block the renin-angiotensin-aldosterone system by inhibiting the conversion of angiotensin I into the active angiotensin II. Times calcium channel blockers depress the contractility of the myocardium and decrease the cardiac work and the requirement of oxygen. Thank you for watching. We will see you in the next video with the next chapter.